Everyone, it's Dr. Jess. In today's video, we're going to continue the conversation about the pharmacology of diabetes medications, but we're specifically going to look into the class of medications called sodium glucose cotransporter 2 inhibitors, or SGLT2 inhibitors. And some medications that belong in that class include Empagliflozin, Dapagliflozin, Canagliflozin. How do SGLT2 inhibitors work and how do they help in type 2 diabetes? SGLT2 inhibitors, they inhibit the sodium glucose cotransporter 2 or SGLT2 in the proximal tubule, as seen in the picture below. SGLT2 is the main site of reabsorption of filtered glucose. So then by inhibiting SGLT2, they then reduce the reabsorption of filtered glucose. What does that lead to? That leads to an increased excretion of glucose in the urine. And what does that do? Then that leads to a reduction in plasma glucose concentration. And that's how they help patients with type 2 diabetes. Let's talk about their place in therapy. So we've already mentioned that SGLT2 inhibitors can be used in patients with type 2 diabetes. So they can be used either as an adjunctive agent or as alternative monotherapy for patients who either cannot be controlled with metformin alone or are unable to take metformin. SGLT2 inhibitors have also been shown to have cardiovascular benefits, so most specifically with atherosclerotic cardiovascular disease and heart failure. So for example, in patients with type 2 diabetes and who have established ASCVD, Empagliflozin, for example, is approved to reduce the risk of cardiovascular event and cardiovascular death. Empagliflozin, for example, can also be used for heart failure in patients with or without type 2 diabetes. SGLT2 inhibitors have also been shown to have renal benefit, so can be used in patients with chronic kidney disease, and that's with or without type 2 diabetes. Now, let's talk about some of the side effects of SGLT2 inhibitors. They can cause urinary tract infections, yeast infections. They can also cause acute kidney injury, so renal function monitoring is important. They can also cause hypotension or volume depletion, so monitoring blood pressure is also important. If you've made it this far into the video, please don't forget to like the video, subscribe to my channel, turn on your notification bell so you don't miss out on any new uploaded video. Okay, so lastly, some clinical pearls about SGLT2 inhibitors. So as I've mentioned, assessing renal function is important. Dose adjustment may be needed for that class of medication. Monitor blood pressure, as this class of medication can cause hypotension, and also monitor for signs of urinary tract infection and yeast infection. All right, that's it for today. I'll see you on the next one. Don't forget to like and subscribe on your way out. Bye.